Hi guys, Dr. Lamb. We are here to talk about plantar fasciitis and surgery for plantar fasciitis. Yes, surgery. Small amount of patients will benefit from surgery. Majority of patients, I would say 85-90% of our patients do well with conservative care. What is conservative care? Well, you have non-steroidal anti-inflammatories, you have stretching techniques, physical therapy is really big, inserts, injections, etc. There's also shockwave therapy, but let's say all those things fail, or you can't afford to pay for shockwave therapy because it is not covered by insurance. But what we have that's a great alternative to that is endoscopic plantar fascial release. I'm going to show you a little video of that later on of an actual case, and I'll talk through it. It's a very short video following this explanation. So you have an idea. This is plantar fasciitis on the bottom of the foot. That's your heel. You can see this nicely marked. So what we're going to see later in the video, there's a camera going in through one side right about here, and it's looking up. It's looking right up at this, just as you're looking up, but that's what you'll be seeing on the, whoa, there you go, going in the zoom. So that's what you'll be seeing later on. You'll just be seeing this tissue, this band of tissue, and then what you also see later on, a blade going in from this side, just cutting this right about here, right about there. That's what you'll be seeing on the video. And why is that important? What is plantar fasciitis? Plantar fasciitis is the inflammation of this rubber band down on the bottom of the foot. It actually looks like a rubber band when we go into surgery. So that's how I explain it to my patients. So why does this cause a problem? Well, number one is it's almost like a pinnacle where you heel strike. Number one. Number two, this tissue right here, you can have a little micro tears or macro tear. You can have a little tearing of this tissue. Let's say you step down wrong, or you stepped out on an object, some Legos, anything. Poor choice of shoe wear, where it's not padded enough, and you're getting a lot of injury, repetitive injury to this. You're not letting it heal. Another theory is you could have some inflammation in the bone inside, or we call venous congestion in there. That's another theory behind that. That's why we see a lot of inflammation on the MRI inside the bone or on the plantar fascia, or both. So obviously, typically we try to do the conservative thing first. If that doesn't work, then we move on to more aggressive surgical care. So we're going to go on to the video of the endoscopic plantar fasciectomy. I'm going to go ahead and try to talk through it. It's really not much. Again, it's a very short video. So again, you'll see me. Actually, the camera is actually inserted on this side, on the outside of the foot, fifth metatarsal side. The camera is going to be coming in this way while I cut this side. That's what you're going to see. Initially, I would go in through this side right here to view everything. But then when we come to cutting, I reverse the camera. I come in here. The camera is there to look. This is the camera now to look as I take the surgical blade. Now this is a surgical blade. Let's see if I could get another pen here to not confuse anyone. This is a surgical blade. Again, the camera is looking, and the surgical blade is right here. And you cut, pull back and cut. And that is what you're going to see on the video. Any questions, let us know. This is a quick procedure. It's about 30 minutes or less from going into the operating room to them prepping, us giving a little anesthesia, to putting in the last stitch, which is only about 2. So go on from there. Any comments, concerns, let me know. Hopefully this will explain one of our common procedures called endoscopic plantar fasciectomy for chronic plantar fasciitis or plantar fasciosis. Hey guys, this is Dr. Lamb. We are going live on the video. This is an actual EPF procedure, endoscopic plantar fasciectomy. This is, again, the camera going in from the outside of the foot, fifth metatarsal side, looking at the medial side of the foot. So you can see that is a nice curved blade. This is all through a couple millimeters incision, actually. As you can see, the fat is underneath on this downside right here, and then the blade is cutting the plantar fascia, which is this white tissue right here. You see the red underneath? That is the muscle belly of the flexor tendon down there, so flexor muscle belly. So we cut until all the white portion is cut, which is plantar fascia. We're only cutting a certain amount that is pre-measured, and you can see I'm moving around the probe. This is just feeling, make sure I have every fiber cut. As you can see, this is a thick fiber right here. This white is the plantar fascia. Again, the red is the muscle belly underneath there. In chronically inflamed plantar fasciitis, you would see that thickened tissue. It requires a couple passes with that blade. Again, it's all done endoscopically. The incisions are really small. We're seeing it on the screen just as you see right here. Looks like it's getting a little blurry from the fog. So that's it.